So we have reached the end of pregnancy, that is, the 8th month. The 8th month of pregnancy has begun. Backache has increased. Heartburn is increasing. Food is not being digested. Constipation has increased. Whatever you eat is not getting digested. You feel hungry, but after eating, you feel that you have eaten less food and are completely full. You are not able to eat. Backache increases a lot. You start having a lot of pain in your legs. Piles have increased. All these problems start increasing in the 8th month. The reason is that your stomach has grown a lot and your diaphragm, which separates your chest and stomach, there is a membrane inside. That membrane has started thinning. Because the uterus has pushed it upwards, the capacity of your lungs has reduced. You feel breathless while talking, you get tired, you feel very tired. You feel tired and feel like sleeping. Swelling in your feet increases a lot. Especially it increases a lot in obese ladies who have gained fat. Those who already had a high body weight and have already gained 12 to 15 kilograms during pregnancy. Now they get a lot of ankle swelling and cramps start. So all these problems increase in 8 months because your baby weighs 2 to 2.5 kilograms. Because you have crossed 7 months and the baby has grown quite well. However, if the baby is born in 8 months, then it is high risk, because his lungs are not developed properly. However, if seen, in the 8th month all the systems of the baby, be it intestines, kidneys, liver, heart, lungs, everything gets developed properly. That is why if the child is born in the 8th month, especially after 34 weeks, then the child is not given steroid injection. When you start having delivery pain, the doctor always gives you steroid injections, 2 doses of betamethasone and dexamethasone, so that if the delivery is taking place within 24 hours or 48 hours, the child's lungs mature, but an 8.5-month-old child who has crossed 34 weeks does not need this. So by the 8th month, the child has developed a lot. And your problem has increased a lot. At this time, your child is 18 inches long, i.e. 1.5 feet. Because of this, you can feel the child's knees up to the child's elbows, especially if we keep our hands on the stomach of thin ladies. Then sometimes we can feel the child's movement completely, or sometimes, the child gets hiccups and even the baby's stomach. The patient feels a thick white or yellow discharge starts from your breast, which we call colostrum. When you give birth to a child, you will not get proper white milk for 2 days, you will get a thick yellow-colored liquid which we call colostrum, which is very important for the child. It has many antibodies in it which increase the immunity of the child, so that is not proper milk. There is secretion before milk which starts from the 8th month, because the body is preparing for delivery. So somewhere your uterus mouth starts expanding a bit, your suprapubic pain. Why does the pelvic bone on the front side pain? Because it starts to spread. A hormone called relaxin is released, which relaxes your joints a lot. It makes you move, you start having pain and the mouth of the uterus starts opening a little. Then your vaginal white discharge increases a lot. Many times the patient rushes to the hospital and says that her sac has burst. The sac does not burst, it is just a white discharge which comes out in large quantity, in the last of the 8th month. Contractions start inside the uterus which we call Braxton Hicks contractions. These are false pains which you feel that the stomach is getting tight, then it is getting loose and then it is getting tight again. She does not have pain, she just feels it, which we call Braxton Hicks contractions, which starts from the 8th month. Because the size of the uterus has increased and the placenta which is contained inside, the placenta, fluid, the baby have grown a lot, so in the 8th month, this much. Now we will come to the 9th month which is very important.